Hi, my name is Josh. I'm a third year student nurse and I'll be demonstrating a female catheterization today. In the scenario, I would have entered the room. Hello, my name is Josh. I'm a third year student nurse. Today I'll be inserting a catheter into you. Can I check your name and date of birth? I'll also examine their name band, make sure that I can properly identify them. Do you have any allergies to latex or iodine? If they say no, we can proceed as we would. I'm going to do hand hygiene. At this point, I think I'd like to raise the head of the bed and make sure they're in an optimal position, slightly spread legs. And now we'll move over to my supplies. I'll do hand hygiene again though, why not? Just make sure we have everything. We have a Foley bag, we have our 12 French catheter, and we have our catheterization kit. And we have our sterile gloves right here. We don't have any sterile gloves in lab right now, so these are what we're gonna have to use for today. Move this onto the table, or the bed, sorry, I guess. And I'll wipe down my area before I open anything up. Okay, now we're going to do pericare. We're going to do pericare to make sure that the client is comfortable, promote aseptic technique, reduce infection risk, and yet again, hand hygiene. Next, now we're going to open up the sterile field. Opening away, grabbing my tongs. And grabbing it out for myself. I got my sterile drape here, my fenestrated drape here. We have these swabs in place of iodine, just for the sake of the mannequin. Lubricant, extra pair of tongs, and 10 milliliters of sterile water. We don't have a specimen thing in here, but we're also not doing a specimen collection today, so it's not necessary. Okay, now I am going to take my catheter out. Carefully. Put it in here and don my sterile gloves. They would be like folded in. I'd be careful to make sure that I maintain my sterile technique while putting them on. Going to now actually pull this out of the blue bag into the garbage and attach my sterile water syringe to the balloon port. And I will also open our lubricating jelly. In order to kind of protect the end here, as well as lubricate it in the meantime. Okay, the iodine tray, or the iodine swabs we now have opened at this point, and I'm going to prepare my fenestrated drape for the client. It's already been kind of ripped, unfortunately. This isn't my first time. Place it comfortably around the client, if possible. That's gonna have to do for now. Next, I will be taking my sterile drape to extend my field, making sure the absorbent side is down or up. Now, something we can do to make things a little easier for ourselves, we can put the boat actually onto the bed. If we line this up, it can kind of hold the catheter even. At this point, now we're going to perform some extra pericare around the urethra. I'm going to spread the labia And I'm going to grab my first iodine and I'm going to clean down the side, place that into the garbage. On the opposite side, place this in the garbage. And right down the middle, place into garbage. Now that the lube's been applied, we can pull the catheter out and begin our insertion. Okay, this might be a little uncomfortable. Just take deep breaths. Ready, and we go. Be moving in until I have some urine output, and then I will try to pinch it. So that nothing comes out. We met some resistance, so we know we're in the bladder. And I will now inject 10 milliliters of the sterile water into the balloon, assessing the client for discomfort or pain that would be considered out of the normal. Okay. Now, while maintaining positive pressure, I'm going to, first I'll make sure that it's actually, we've met more resistance with the balloon, so we know that it's inside the bladder and it's not coming out. While maintaining positive pressure, I'm going to remove the syringe and I will attach the bag. At this point, urine can flow freely. I'd be noting color, amount, things like that into the bag. And now I will be cleaning the client up. So I'll get rid of stuff that does not need to be there. All this is going into the garbage. I'd be tearing this now to get it also into the garbage. I'd have some wipes with me to remove excess lube that would be just like in the area causing problems. And then after that, I would either use a stat lock. Hopefully we would have a stat lock, at the very least some tape onto the leg. Cover the client back up, and then afterward, once I made sure the client was comfortable and had everything they need, I'd be documenting the size of the catheter, the quality of the urine, and if we did collect a specimen, here we didn't, and then how the client tolerated the procedure, anything of note regarding pain or abnormal discomfort. Once the client's situated and we've cleaned up, we are good to leave the room because that would be a female catheterization.